holiday season. So I am Sophia Chaudhary, a pediatric emergency medicine physician at Children's Healthcare of Atlanta and with Emory University School of Medicine. I'm also a pediatric injury prevention researcher and one of the PIs for the Atlanta chapter of Injury Free Coalition for Kids, along with a core faculty member at the Injury Prevention Research Center at Emory. I will be your moderator today for today's session, and I am so excited to see so many of you that have joined us, not only from the Southeast, but across the US. So it's just some housekeeping. You may have noticed that we hit record early on. So we are recording this session, and an email link will be sent for the recording to all the attendees, and that will include any of the resources that we mentioned today. So before we dive in, I'd like to take a moment to thank our wonderful sponsors for the support that they have given us in putting together this webinar. We could go to the next slide, please. So that includes our Injury Prevention Research Center at Emory, Children's Healthcare of Atlanta and their Strong for Life team, including the Children's Injury Prevention Program, the Injury Free Coalition for Kids, and the Region 4 Public Health Training Center. I'd also like to thank two additional individuals, Jill Woodard from IPRCE and also Stephanie Verna from IPRCE as well for all their support in putting this webinar together. Let me go ahead and go to the next slide. So the Region 4 Public Health Training Center serves the 8 states in the Southeast. Its central office is located at the Rollins School of Public Health at Emory University, and they work with 7 community-based training partners and 2 technical assistance partners to serve the entire region. The mission of the training center is to build capacity of the current and future public health workforce and to protect and promote the health of communities in the Southeastern United States. They offer professional development for the workforce, experiential learning for students, and consulting and technical assistance to the health departments. The website is rich with free resources and trainings to support your work, which you can see here. If you haven't seen it before, we encourage all of you to check it out. And we'll put the link in the follow-up email that we'll send out at the end of the webinar. You can sign up for the listserv through the website and be the first to learn of any upcoming trainings. We can go ahead to the next slide. So our webinar today is in honor of the upcoming National Injury Prevention Day on November 18th. This is the 4th year in a row that the National Injury Prevention groups here have partnered with Injury Free Coalition for Kids to raise awareness and empower communities to stop injuries and violence. There is still time to participate in the social media chat on Friday, so tomorrow, November 17th from 1 to 2 p.m. Eastern time. You can scan the QR code for more information, and I encourage you all to join us, follow the conversation, and contribute to how all of us can be injury-free within our spaces and communities. I'm honored now to introduce our speakers for the webinar, starting first with Lisa Dawson. She has an MPH from the Rollins School of Public Health and is currently the director of the Injury Prevention Program within the Division of Health Protection at the Georgia Department of Public Health. She's also an instructor at Emory University, Rollins School of Public Health, a member of the Injury Prevention Research Center at Emory Steering Committee, and their Outreach Core Director. She has worked in public health and injury prevention for almost 30 years and serves on numerous injury prevention-related advisory committees, councils, coalitions, all at the state level. She started her career on a child safety seat grant and transportation safety in the mid-90s, and her work has soon after that, suicide prevention, fire safety, domestic violence prevention, and prevention of child abuse and neglect. Her interests have evolved to utilize a comprehensive applied public health models and evidence-based communication tools, and to mentor students and new professionals in public health and injury prevention. And I can say that I have definitely benefited from her mentorship over the years myself. So thank you, Lisa. Next, I'll introduce Dr. Manisha Agarwal. She is one of my colleagues in the Department of Pediatric Emergency Medicine. She's an associate professor in pediatrics and emergency medicine at Emory University School of Medicine, and she's an attending physician in pediatric emergency medicine at Children's Healthcare of Atlanta. She received her undergraduate and medical school degrees at the University of North Carolina in Chapel Hill, followed by a pediatric residency in the Boston Combined Residency Program in Pediatrics, and her pediatric emergency medicine fellowship at Carolina Medical Center in Charlotte. Her prior work encompasses multiple areas, ranging from poisoning prevention to helmet use to many other topic areas. Dr. Agarwal has served as a national, regional, and local leader in pediatric injury prevention in the Injury Free Coalition for Kids, Georgia and the National American Academy of Pediatrics Council on Injury, Violence, and Poison Prevention, for the Trainees for Child Injury Prevention, the Center for Disease Control and Protection, PROTECT Task Force, and the Children's Healthcare of Atlanta Injury Prevention Program, which she has also co-founded. And then additionally, the Injury Prevention Research Center at Emory and Safe Kids, Georgia. So moving now onto our agenda for today, we are going to be starting with a brief overview for why we are here. Why are we focusing on injury prevention? Followed by a conversation with our two speakers as they provide practical guidance and tips on how to prevent injuries regarding the topics listed here. We will also highlight available resources and provide advice regardless of whether you are traveling to new spaces and environments or staying put this holiday season and gathering in your own homes. We'll take questions throughout the presentation as time allows, so feel free to put them in the Q&A box. But we will have actually dedicated time at the end allotted for Q&A. So why are we talking about injury today? Unintentional injuries are the leading cause of death for ages 1 through 44 years. And this has remained true for over the past 4 decades, so since about the 1980s. And this includes poisoning such as opioid overdoses, motor vehicle crashes, drownings, falls, and more. Suicide, as you can see here, is a leading cause of death, with more than 48,000 deaths by suicide in 2021, or in other words, 1 death every 11 minutes. Firearms are the most common method used overall for suicides and make up more than 50% of these deaths. In terms of high-risk groups that we have found noted in 2021, among adults ages 55 and older, the highest rates of suicide were in men 85 and older, and in women 55 to 64. Suicide, as you can see here, is also the second leading cause of death for ages 10 to 14 and 25 to 44. American Indian, Alaska Native, and white youth have the highest overall rates of teen suicide, but we are now seeing the highest rates of rise in suicide deaths amongst minoritized youth. Additionally, those who identify as sexual minorities have higher rates of suicide attempts in comparison to heterosexual individuals. Homicide remains the top 5 as a leading cause of death, with firearm homicide being the highest in 25 years in 2020. The populations that are most at risk are youth and young adults, males, and specifically Black young adults. Unintentional injury has contributed to more years of potential life loss than any other cause of death. We can go on to the next slide. And you can see the breakdown of the top injury mechanisms for unintentional injury fatalities listed here. This is a significant public health concern, and there are lifelong impacts for experiencing injury or violence on individuals, families, and communities involved, including missing work or school, frequent hospitalizations, suffering disabilities, or being treated for chronic illnesses. There are also societal costs for injury and violence that are substantial, with the CDC estimates of billions of dollars in medical care and lost productivity annually. So there are a lot of reasons for why we are focusing on injury prevention today. And to be able to tackle unintentional injuries and violent injuries as the leading causes of death in our society, we need a comprehensive approach that includes understanding both risks and protective factors and how they interact and how they may impact each other. And additionally, disparities across injury mechanisms, including some of the ones that I listed earlier. All of this to inform implementation of evidence-based prevention measures such as education, such as the webinar that we're giving today, environmental modifications, community engagement, and policy interventions to reduce injury risks and promote safe behaviors. And that brings us to our topic at hand. Holidays are a time that there are new environments, excitement, and at times chaos, which can lead to injuries across the spectrum of age, whether that be a young child or a baby to older adults. And I know that, and I'm sure many of you can relate, that whenever I work a holiday shift in the ER, I am bound to treat an injury from trying out the latest toy or gadget, but not always with the safety equipment recommended. So let's hear from our experts on how we can stay safe and fun during this holiday season. We're going to start with our first topic, secure beforehand. So in preparation for visiting family members, are there items that either you, Manisha, or Lisa recommend that parents and caregivers ask their hosts to secure and put away prior to visiting? To give you an example, I know that when my parents come to visit our house, I ask that they store their pills in safe places, that they are in a pill box, up and away, out of reach so my toddlers can't access them. Similarly, I am picking up small toys and moving rugs away from their sleep area so they don't get tripped and injured. I think that all of us have stepped on that unfortunate Lego and experienced extreme pain beyond comprehension. So what are some of the things that you recommend?
Right. So I think it's so important to think about safety before you go somewhere or someone comes to visit you. Prevention is so, so important just to prevent anything ruining your holidays. So things that I'm thinking about when I'm visiting someone else or someone's coming to visit me, I'm thinking about, our dangerous areas locked away or prevented from easy access for my child. So do the pools have appropriate fencing around them? If not, can the person I'm staying with make sure they're appropriately closed and fenced before I come to stay? I also like to talk about pets. Holiday seasons and big gatherings can be stressful even for our furry friends. You might have a pet who does beautifully with you and your own children, but add in new scents from all the cooking and holiday decorations, add in lots more people, add in children who are unfamiliar with pets and might not know how to properly approach a dog or a cat, how to read warning signs that that animal is stressed. And you're spelling potential disaster for the child and your furry critter, who may also pose a tripping hazard for people who might not be used to stepping around animals like cats and dogs as well. I also think it's really, really important to talk beforehand about where everyone's going to sleep. And this is not just about, making sure everyone gets appropriate sleep, but it's important to think about when you're talking about young children and safe sleep in particular. We know that infants need to sleep in their own safe sleep space. So alone in a crib that's clear with no toys or objects in there. And if you don't talk to families where you're staying beforehand, they might expect for you to sleep with the baby in your bed, which is not a safe situation. All of this can be prevented if you have the conversation beforehand. And so I really, really encourage people to have those conversations before someone comes into your home or you go to someone else's.
That's really great advice. And I will say that, myself and my spouse have had to buy a pack and play at the last minute at a previous trip because we'd expected there to be a space and there wasn't. And so to avoid some of those last minute hassles, being prepared ahead of time, that's really great. How do you approach talking about guns or making sure no marijuana edibles are around or accessible? Your family members may be gun owners. Are there any strategies for bringing up that topic?
Right. So,
Sure.
oh,
Oh, go ahead, Misha.
I was just going to say that I blame my child. I have several small children of my own, and I like to talk about how curious they are and how they're getting new skills every single day. My toddler specifically loves to climb everything. She has recently taken to trying to climb her kitchen activity center, which is firmly anchored to the wall. And so I kind of blame them. I brag about how my child's getting new skills, how they're expert climbers, how they're super duper curious. I talk about how my oldest will, if she finds a bag of candy or Indian sweets, she will consume everything possible. And that could include THC edibles or, cannabis edibles, because they can look like candy and she's not going to know the difference. So I try to put the blame on them. And then specifically for my own parents, where I also sometimes struggle with encouraging them to securely remove or place their medications where my children can't access, I like to sometimes remind them if they're still pushing back, like, hey, you remember when I was a kid and I got into X, Y, and Z? Yeah, my kid's just like that. Do you remember that? And sometimes that's that extra little trigger for them to be like, yeah, she's probably right. Maybe I do need to think about safe storage before she gets here or my kids get here.
Thank you so much, Manisha. So moving on to you, Lisa. So the same questions. Are there items that you recommend that hosts secure and put away prior to visiting? And then similarly, any strategies that you recommend related to particular items such as edibles or firearms in the home?
Sure, thanks, Sophia. We definitely, personally for me, I try to encourage either myself or my partner to get on our knees on the floor and look around like a toddler. There's nothing like seeing things from their perspective, and it helps you to really identify some of the things you're talking about. The kids' grandparents, our parents, and caregivers, they often live in adult only kinds of environments. And so they don't have to be careful in their own environment with things like their medication. So that's really hard for them to have to switch gears and think about, they're visiting somebody and to not leave medication out. So they want their grandchildren and the kids in the house to be safe. So having a conversation and engaging them in, hey, have you thought about maybe getting a different kind of pill box, or can we put it up in the cabinet in the kitchen, or can we do something different with it, so I can help you take your pills on time, but also keep it out of reach. So those are some of the strategies to engage. As a mom and a parent, I'm fairly direct when my kids are visiting other houses. It's kind of we're going to talk about this a little bit later on, but it's an important boundary to ask about what is in reach and accessible. And one of the things I've always been reminded of is we could always find the Christmas presents in our house, or Hanukkah presents, or whatever presents are there. It's not a secret. They're in the top of mom's closet. Okay. So kids are experts at knowing what's coming in and out of the house and where things are. They definitely snoop when parents aren't around, caregivers aren't around. So they know for sure. And I've had to have that conversation with a parent to say, your child showed my child a firearm that was not secured. And so we can't come here until you can assure me that that is secured. So those are the kinds of conversations to think about having. Yeah, and I just really appreciate that y'all mentioned right away, securing things and falls for Georgia and for most of the nation. Falls lead your trauma data for 65 and up. They lead your death data for 65 and up. They lead your EMS data for leading injury cause. Falls are something across the lifespan. I will tell a quick story because Sophia started one Thanksgiving. We were at my brother's and he had built this really lovely play structure, elaborate. It was not CPSC to CPSC standards, this Consumer Product Safety Commission. And we took our 6-year-old to the emergency room for a broken arm from a fall. So, those are the kinds of things that come up. So just having conversations and visualizing where you're going to be and thinking about it from your child or your parents' perspective is super helpful.
Thanks for that, Lisa. And I will say that it's often a balance. So I will say that on a recent visit from my parents to our house, my mom had put up her pills away on a high shelf cabinet, and I come down the stairs and see that she's standing on a very unsteady chair to get them down. And so there's always a balance, right? And so figuring out a strategy that works for everyone, and maybe at least for our instance, keeping their pills in their room and a shelf that's still accessible to her where she doesn't have to climb and put herself at risk for a fall. And then also us not ending up in the emergency room since our 18-month decided to take grandma's pills. So always a balance. And, thanks to both of you for these tips and strategies. So a lot of us are going to be traveling in the upcoming weeks. And with holiday travel coming up, what are some considerations for traveling safety with the family by road, or if you are flying? Starting with you, Manisha.
Right. So a lot of people hit the roads for the holidays, right? And so I think one of the first things you can do is actually make sure if you're driving that your vehicle is safe and stocked. So, are those tires properly inflated? Are there any lights on, like your check engine, check oil lights, that you need to address so you can drive and arrive at your destination safely? Similarly, if your car does break down, do you have things to stay safe? Do you have snacks packed? Do you have blankets? Do you have any roadside equipment that you think is important to have to stay safe if your car gets stranded? I think it's also really important to reevaluate how everyone is restrained in the vehicle. So that means for adults and teens that they are wearing seat belts. But for younger kids, we know it's a little bit more complicated. So making sure that your child is in an appropriate car seat or booster seat. If you have never seen a child passenger safety technician, or if you've maybe changed from a car seat to a booster seat or just changed out your car seat, it's a great opportunity to go meet with a child passenger safety technician, make sure your child is appropriately restrained, to make sure that the device is actually appropriately installed in the car, and just make sure that you're keeping your child as safe as possible. We frequently talk about firearms being a leading cause of death for youth, but motor vehicle crashes are up there too. They used to be the leading cause of injury related death for our youth. So really taking this seriously is so, so important. I also think it's important to, one, remember that as the weather is getting colder, that you do not, whether you're an adult or child, want to have your thick, puffy winter coat underneath the straps of the restraint. That renders the restraint much less effective. Essentially, when you get into a crash, that puffy space is going to decompress and you're going to have all this potential space. So you could actually kind of move significantly or even be ejected from the car seat or the car if you're wearing a regular seatbelt. And then I also think it's important to remember or to remind anyone else who might be driving your child. So I grew up in the 80s, and I definitely remember being like 3 or 4 and sitting in the front seat of my father's car, and I could not even look out the car window and see what was going on. That was how things were from a safety perspective back then. And it doesn't mean that was safe or right. We know better now, but my parents who don't regularly drive my children may not realize that the recommendations have changed. And so it's super duper important to make sure that if you're letting, your aunt or uncle, or you're letting a grandparent or somebody else drive around your children, they understand the proper way to make sure their child is being transported safely.
It's a really good point. Making sure that everybody's on the same page for child transport. Another question related to travel, and this recently came up for my family over the summer. We were taking our kids on a abroad trip, and we ended up taking their car seats, but we're looking into these riding vests for our oldest since he was 4 at the time, and we saw that it was approved for ages 2 and above, and it met crash test requirements and federal safety standards, at least by the packaging, and what we found online. What are your thoughts related to using products like this?
So it sounds like you're probably referring to what's called the Ride Safer vest. It is actually a product that is approved by the Federal Vehicle Motor Safety Standards, and you want to make sure that any device you're using to keep your child safe during transportation meets that standard. And it is important because you have to remember, if you're buying things online, sometimes there have been counterfeit car seats and products available that don't meet those standards. So if you don't see that label that it meets standards for the United States, it's not safe to use. But the Ride Safer vest does meet that standard. Now, most child passenger safety experts recommend that you reserve use of that particular product until your child is close to 5, just to optimize fit. Basically, what it does is it pulls the seatbelt down into appropriate safe positioning for the child. So instead of a booster seat boosting a child up into an appropriate position so the seatbelt works, it brings the seatbelt down to appropriately restrain the child. When it comes to travel, though, on airplanes, we really, really recommend that whenever possible, children have their own seat. So yes, you can fly with an infant or toddler in arms up to the age of 2, but that doesn't mean they're safe. They can become projectiles. If there's turbulence, no matter how hard you want to hold and hug your child, you can't predict when the turbulence is going to come. And even if you can, they can still go flying and hit the walls or the ceilings of the cabin. So it's another really important thing to consider. And then if you're flying with them on a plane and you have the space, you really want to take the car seat or booster seat on board with you. And if it says it's approved by the FFA or FAA, you can actually install the car seat or booster seat on the airplane to try and keep your child appropriately restrained. I know it's so hard when you're traveling with your child and making sure they have the appropriate car seat and booster seat. So other pearls I think it's important to remember is car seats and booster seats are kind of one crash use devices. So if there's been a big impact to the car seat or booster seat, the foam or plastic inside the device that's meant to absorb the forces and protect your child, they have kind of been used, they've been expired. So thinking about the forces applied to a car seat or booster seat when you're in a crash, think about how people handle our luggage on airplanes, right? If they're taking your car seat or booster seat and they are chunking it onto the little conveyor belt that goes into the airplane, or even if they put it very gently into the cargo hold of the airplane and you hit turbulence, you're essentially rendering that device not effective anymore. So it's something else to consider when you're thinking about how are you going to have your kid appropriately restrained when you get to your, end destination after flying.
Thanks, Dr. Agarwal. Lisa, over to you. Any thoughts and considerations for traveling by road or by flight, and your input related to that?
Sure. It's just hard to have all the stuff. You're juggling a lot, and you really have to think through it. Whatever parent or caregiver is taking the child, it's a lot to plan for. I will reiterate what Manisha was saying, or Dr. Agarwal was saying about the child safety seats need to have those labels, and it needs to state approved, FMVSS 213 compliant and FAA compliant for use in cars and use on airplanes if you're going to take them on those different things. It is a way to figure out counterfeit seats. If you have doubts, there are car seat technicians throughout the country. Parents and caregivers can seek them out and have those conversations ahead of time. Our lead instructor, program manager for child safety seats here in Georgia was telling me that the airlines are getting pretty strict about checking the labels for FAA compliance on car seats that are intended to be used on a plane. So that is probably something that's a little bit different that you might find at the when you get board the plane. It is so much easier to manage kids who are in their own seats. They from traveling with two, it allows them to sleep, it allows them to play, it allows them to just have their own space, and that's ideal. Not everybody can afford that. We do good, better, and best, and we do the best we can with what we've got. So but thinking it through ahead of time and making some plans and having some contingency plans are a great idea. It is incredibly disconcerting when you get someplace and the rental car folks said that they had a seat for you and actually they're out because it's the holidays and everybody's traveling. So definitely would travel with my own.
Yeah, and just piggybacking on that rental seat or rental car, as far as car seats go, you also don't know if they are safe. I made the mistake when my oldest was really young trying to get a car seat from a rental car agency. They had it in stock. It was totally beat up and dirty and gross, and I didn't trust it. So I actually got my dad to take me to the nearest Costco, and we bought her a brand new car seat because, like, I'm not putting her in this thing. I don't trust it at all. So that's the other thing, is I would be very hesitant and really would encourage, if you can, to not trust a rental agency's car seat or a booster seat that they might say, hey, we have this for your child.
It's fair. You really don't know the history of it. In theory, the car rental place should be keeping up with, you know, whether or not something's been in a crash and replace it and those kinds of things. But, you know, the folks who get those back, they may not have ever seen that seat before. So really bringing your own is probably going to be the safest and most convenient choice. You know, we all have trade-offs and choices. So yeah.
Yeah, I agree. It's always tricky trying to figure out, you know, not only your luggage, but then how many additional things, right, that you're taking.
Yeah.
But we know that car seats are critical for transport for young children. And so one of the other things that you could potentially do is you know, also have, if you travel a lot to a certain destination, which we've done with our family, is that we and also are using multiple different cars, that we have an extra set at grandparents' home, and that's often helpful. But you know, you don't necessarily always have to do that. If you can take your own, that's easier. So moving on to our next topic. So naturally, there's going to be food involved when family and friends get together, and often cooking multiple things at one time. During the visit, fire pits and turkey fryers are both very popular and all the rage now. How do you both recommend that we keep everyone safe while still enjoying a good meal? Starting with you, Manisha.
So I think the key message we keep echoing throughout this webinar is preparation ahead of time, thinking about things beforehand. And so that includes, if you are hosting some really amazing food and cooking at your home, to make sure you do some prep work, not just for the food, but making sure, hey, is my smoke detector, is my carbon monoxide detector, are they working? And then making sure that you have working fire extinguishers too. Anything that you would use for a kind of escape plan if there's a fire, making sure that is available and functioning as well. And then thinking about how you can maybe keep little ones from getting into the kitchen if there's a lot of exciting cooking going on. So at my own home, I have gates that gate off my kitchen, which definitely helps keep my children safe. You still have to be careful, because I've had guests who sometimes unwittingly fail to close the gate all the way. Even though they're auto latching, they just might prop them open. And the next thing you know, I have a toddler running into my kitchen behind me while I am doing something with the stove. I think it's also important while you're cooking to think about the basics, like trying to use the back burners of the stove whenever possible, trying to use stove guards as well to add another layer of protection for these kids. But you know, ultimately, when you're visiting someone else's home, like when I go to my parents, I can't, you know, necessarily insist that I have baby gates. And the way some homes are designed now with the open concept, it can be really, really hard to have certain things gated off. So one concept we use in pool safety is the idea of a water watcher. So the idea that there's one dedicated adult for each child who is constantly eyes on that child in and around the pool. This concept can work as well when it comes to things like being in an unfamiliar environment, when you're worried about injuries and scald burns and what have you in the kitchen. You have to be really, really meticulous about this, though, that like I am responsible for this toddler. I am watching them. I'm not playing on my phone. I'm not getting distracted by the football game. I am watching them at all times. If they are being crazy, I am holding them, which can be your own little Thanksgiving meal workout if you're holding a squirming toddler, right? And then if I have to go use the bathroom, then I am clearly identifying someone and looking at, say, my sister, and like, hey, you're on toddler duty. You need to wrangle this child, make sure she is safe until I come back and can relieve you, and making sure there's that very clear communication, which can be helpful again when you're in these, you know, situations. I think the other thing that I just want to make sure we mention and talk about when it comes to fire safety, I also always think of burns, and we have to remember that children can also suffer from scald burns, even adults, right? In the context of cooking and, you know, just day to day, even, you know, coffee can be really, really hot. Tea can be really, really hot. Are you making sure you're keeping that away from kids? Are you being careful about kids, you know, accessing hot items? I know sometimes people like to let kids cook their own meals. Maybe you have to, you know, you're busy and you're asking your kid while they're home from school and you're still working, hey, can you make your own ramen noodles or, you know, cup of soup or what have you? But you have to remember those things can get really hot and cause some pretty significant injuries as well. So just some other food for thought on the topic too.
Thanks, Manisha. Lisa, over to you. Recommendations for keeping everyone safe while cooking and around stoves and fire pits and whatnot.
I love the pun, food for thought. I'm gonna have to see if I can outdo that, Dr. Argwal. So just comprehensively, you know, the scan of the environment, a couple of things. Safety plan is really important, especially when you're in an unfamiliar place. So at home, everyone should have a fire plan, fire escape plan. What's gonna happen if the smoke alarm goes off? What happens? In our house, as should be in everybody's house, get out, period. There was a particularly tragic fire a few years back where the mom escaped and the 3 daughters did not, because they were looking for a phone to call the fire department. So bottom line is get out. Where's the meeting spot? So Bill and Mary's front porch is where all of our kids and guests are going to go if a smoke alarm goes off, and then we assess what to do from there. We get help from our neighbors, and they know that they're our backup, so they're going to expect everybody on the porch. One day, the very first time I ever left my 2 kids home alone, of course there were muffins in the oven and the smoke alarm went off, and they executed beautifully, and it was really affirming and heartening to know that they knew what to do, and the neighbors knew they were coming, and the neighbors knew to call. So it was a really great test and a happy ending to things. We have some other fire hazards pictured on our slide. The turkey fryers are particularly an issue for fire departments. They run a lot of calls for turkey fryer fires. There's your Thanksgiving tongue twister. They absolutely run a lot of calls for that. And then another fire hazard that people really don't think about, because it's like, I've got an extension cord, I've got things to plug in. I plug in things all the time without any problems. Overloaded extension cords are an enormous hazard, especially when you've got them loaded up with, you know, all the gadgets, and then the teenage girls go to plug in their hair dryer and their curling iron and all of those things. So you know, really thinking through again, and preparing for that scan of the environment, what's appropriate for your children and your family, having a plan, an exit plan, and then having kind of some, you know, contingency plans as well. Well, gosh, if I can't, you know, if I can't, you know, have baby gates, how about I do bring the pack and play, or ship the pack and play, or have somebody borrow a pack and play before I get there. There's lots of ways to figure it out, but the list is long. So scanning the environment, thinking about the developmental appropriateness for all the members of the family, and trying to have a plan and even contingency plans when possible, and being in unfamiliar environments. That's very helpful. You'll be happy you thought it through and or had some of those things in place.
Yeah, I think that's really great. And I think even right when you get to your destination, right, just asking a cousin, aunt, or whoever you're visiting, hey, let's say something catches on fire. What's the closest exit? How do we all get out? Right, having a plan. Being
Absolutely.
prepared, for the inevitable.
I forgot to talk about hotels. Really, just if I had to get out of here with my eyes closed, which way would I go for the stairs? Which way? So and relaying that information that, hey, if we had to get out of here quickly, was at a safety conference and the hotel alarm went off at 7 o'clock in the morning, and it was great jokes in the parking lot. All the safety people were outside.
Nice. Everyone, was
Yeah.
everyone else sleeping? Kidding.
Yeah, my husband included was like, yeah, I knew I had time. You don't always know that. Thanks, man. Thanks for keeping me in a job.
That's awesome. So a new report from the U.S. Consumer Product Safety Commission recently actually came out. I think it came out this past week, entitled Toy-Related Deaths and Injuries. And it highlighted the importance of safety when buying and playing with kids' toys, even for older children. So what they noted was that in 2022 alone, there were 11 deaths and an estimated of 500 emergency department ER visits associated for toy injuries for children 12 and younger. Most of the deaths were attributed to choking or asphyxiation due to small parts, balls, or balloons. And then among the ER treated injuries, non-motorized scooters accounted for the most injuries across all age groups. Approximately 1 in every 5 toy-related injuries to children ages 14 and younger were from these non-motorized scooters. Hearing that, are there any particular tips on gifts to avoid gifting to younger children or even your teens, or things that may not be appropriate for a child? And additionally, what are your thoughts on some of the trends like hoverboards, ATVs, BB guns, especially during the holiday time? Starting with you, Manisha.
Wow, there's a lot to unpack on this topic. So many different things to think about. And when it comes to choking, I think it's really important when you're buying a product, first of all, to look and actually see what it says is the appropriate age for the child. Sometimes I've seen people be like, oh, it says like 5 and up, but my, 3-year-old will be fine with it, or my 2-year-old will be fine with it, but it actually has small parts. So that's something to really consider. But you also have to think about the entire family that you are gifting the product to. So I have a 9-year-old, but then I also have a toddler and an even younger child. And so there are some toys that are appropriate for my 9-year-old, but they are dangerous for my other children. And so I really appreciate when people are gifting, if they think about that. But also as a parent, you have to take responsibility. So when we get these choking hazard toys, they go to my daughter's room, and that's it. They stay in her room. They do not come out of her room. They are not safe for her younger siblings, and she knows that. I think you also brought up the non-motorized scooters. And for bicycles, for so many of the fun, wheeled gears that children get during the holidays, it's really important that you're gifting them the appropriate safety equipment, especially helmets. Helmets help reduce the risk of serious brain injury. We know that they work. And I cannot tell you how many times I'm working in the emergency department and I see children coming in and they were on their brand new, holiday toy without a helmet. And when I talk to them, like, well, why? They're like, well, I don't have one. Or the one I had, I outgrew, but this was a brand new toy. So please, 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 if you're considering gifting a loved one a device with wheels where they really should be wearing a helmet, please consider gifting a helmet as well, or at least checking with the parents about whether or not that child has a helmet. And speaking of which, in general, when you are gifting a product, I know most parents out there appreciate if you check with them first. Even if it comes down to something about a safety concern, there are certain products featured here that are just not safe for children that you would want to stay away from, and the parent could hopefully guide you away from them. But even just what they might already have or want in their home, I definitely, as a parent, take note as to who gives my children the very, very, very loud and annoying toys that drive me crazy. And so it's not a safety thing, but I notice, and I really appreciate when people ask, hey, is it cool to get this, for your child? And then I can say, like, yeah, I don't know if I would personally appreciate my child having a recorder that they're running around the house playing, but then it also gives me an opportunity to weigh in on what might be more appropriate for them. And then finally, it ultimately does, I think, boil down to the parents or the caregivers. So, people, even with the best of intentions, still may not know what's safe or not safe for children. Even if they have kids, even if they work in healthcare, but maybe not with children, they may not realize it. We recently celebrated a major Indian holiday, and my brother-in-law and his wife gifted us these very sweet little goodie bags for my children. And it included a light up fidget spinner. So the issues with this were that, one, the pieces came apart. So it was a choking hazard for my toddler. And notably, they gifted this to the 2-year-old classroom that their daughter went to. And 2, this device also had button batteries, which can be very, very dangerous for anyone if they swallow them. It can, if a child swallows a button battery and it gets stuck in their esophagus, it can erode through that tissue in a matter of 15 to 30 minutes. It's really, really, really dangerous. And there have been fatalities related to that. So again, you know, if you're gifting a product, make sure you're giving the proper safety equipment to go with it. If you're not sure, it's always appreciated when you check in with the parents or caregivers about the appropriateness of the product. And then finally, that impetus, that onus about making sure the present is safe, it really does fall on the parent and caregiver. And if you're struggling getting away something dangerous from your child, let's say if someone gave my child water beads, which are featured on the screen, which have been associated with fatalities in young children as well. It's amazing what I'm able to get away from my children with the promise of, hey, would you like this cookie instead? Or would you, like this, art kit instead? So that is one way if someone gifts you a product that is not safe and your child has opened it and they're all excited about it, making a trade. At least my children can still get bought out by cookies. You may have to think about what works best for your child, but sweets for the win for me.
That's great. Thanks so much. Lisa, what are your thoughts?
So if it's got wheels, they need a helmet. It's the bottom line. It's really simple. I totally agree with Manisha about, parents buy-in on presents is such a gift in and of itself. There are folks that want to go their own way and do their own thing, and we respect that too. So the both situations happen, but I would definitely say as a mom, I always appreciated when folks were like, well, what do they want? What do they need? And has room for suggestions. I will say a friend had gone on a trip and brought back these really fun, shiny rocks from the geography where they had been visiting. And my 6 or 7-year-old at the time was fascinated with them. She really wanted them. She wanted to play with them. And so I was like, oh, well, let's take a look at them. And as we started to look at them, she took one and popped it in her mouth because it's smooth and it looks like candy. And I was like, you can't do that. You gotta have it back out. And that was kind of her holy grail at that point. As soon as I said, oh no, you can't do that, it became the thing to do. And so yeah, they had to disappear out of the house. They had to disappear out of a house because they are definitely, those little trinkets that well-intentioned friends bring into the house. They most definitely are choking hazards. And yeah, they just have to really consider that. The button batteries and magnets are new. People assume that because something has a CPSC or some kind of standardized certification on it, that it must be safe. Once taken apart, things are often not safe, and kids are super curious. So the considerations that Manisha was talking about are critical. Those are really the severity of those injuries far outweigh so many other issues. And really in a hypoxic event, you don't have a lot of time. So, and with the magnets and the button batteries, those are things that have evolved. That 20 years ago, we did not have such a high prevalence of them. Those injuries are definitely becoming more and more. By far, the greatest injuries that we see in TBIs are from falls and motorized vehicles or wheeled vehicles. I love that you found the scooter statistic, that is top on the list. So, and the message really for parents, as our professional colleagues are crafting messages and thinking about their press releases, the message really is twofold. There needs to be a helmet if there's going to be wheels. And then this needs to be one of those non-negotiable things about, you don't turn on the burners on the stove. And if you get on something that's wheeled, you need to wear your helmet every time. Yeah. So those are probably the messages I'd like to leave our guests with, our participants.
That's great. I think another thing that just came to mind with the button batteries too, not necessarily for gifting, but having if you're having family over that wear hearing aids, they can often be found in them. I know that we have found like my father's batteries for his sometimes lying on the nightstand counter. And so I've had to talk about that and just remind where to keep those because it's fast, right? Like you may be in the same room and then your kid sticks something in their mouth and you're like, how did you do that? Or was standing right next to you. So these are all really great pieces of advice, especially for gifting.
They're also in those gift cards that make, or the holiday cards that make noise when you open them up, the button batteries. And I know that I love those as a child, and my mom loves to give them to my kids. And I'm like, Mom, stop it. Because they drive me crazy and they give me a migraine when I'm listening to it on end, but they're also, that does not resonate with her when I tell her I don't like the noise. But when I tell her, hey, they have an item in there that's dangerous and I will have to rip it out so it doesn't make noise, that resonates with her. And then she does not want to spend the money on those musical cards.
That's great. So moving on to our next topic. Sometimes holidays can be overwhelming at times. How do you encourage respect for space and boundaries? Secondly, how do you make sure everyone is getting the support that they need? Any resources that you recommend for our listeners and guests today that they can provide as they're talking to families and their patients and their community members? Lisa, this is over to you first, please.
Oh, sure. So I think one of the biggest things we as professionals can do is really give permission for people to have those boundaries. You said it so beautifully, Sophia. Asserting one's needs and having to turn people down with a really gentle but firm no can feel difficult, and it can even feel rude. Especially if you come from a background of people pleasing. So it's really tough. But when you're raised in that, and then somebody says, you don't have to do it that way, that's okay. And it makes it okay, and people feel empowered. So if somebody is looking for advice from our MDs who are awesome, and our public health professionals, and our other clinicians, I think empowering them to say it's okay to say no to stuff, and really protect your family and protect your emotional and physical boundaries. And that starts with the relationships closest to you. I think that those are really those can be difficult conversations to have, and one way to start those conversations is to talk about what a healthy relationship looks like. What do boundaries look like? How do you practice them yourself? They're going to look different for everybody, but starting to normalize the culture that boundaries are important. So yeah, that's where I'd start. Anisha?
Yeah. And I think when it comes to establishing boundaries with families and friends, I really do think it's important to really think about and practice what you might want to say ahead of time. I know that, I recently had my family bugging me like, hey, come home and visit for this specific holiday. And I really, before I knew it was coming. So I took a moment to really sit and think about like, not just what's the one thing I can say, but what are the multiple things that I can say to help set that boundary, to help make that excuse. And then I also made sure that my significant other was on the same page and would back me up.
Mhm.
And then when it came time to have those conversations, luckily I had about 5 different things on the list, and I didn't have to go through all 5. It might bite for a moment. My family's a little irritated with me, but at the same time, I also know that they love me. And if they love me and respect me, they are going to get over it. And our relationship is not going to be negatively impacted by this. The other thing that I really want to encourage people, and Lisa, you had mentioned this, is that if you have a concern about safety for your child or just your own well-being, it's okay to blame someone else. And so sometimes I blame that on my children. So for example, I have used the excuse that my child is potty training. You really do not want them peeing all over your floor, right? But then you can also use the excuse and blame the healthcare professionals in your life. You can say, our pediatrician really doesn't want the baby around a bunch of people at this time because there are a lot of bad viruses in the environment, and we really have to listen to our pediatrician's advice. Most healthcare professionals are fine if you blame us and you say, that's what they told me and I need to listen to them. If you do not have a healthcare professional that you've seen recently, blame me. I really am okay with that. You can drop my name. Someone can send me an angry email. I'm really okay with that. But again, when it comes to the safety and well-being of others, this is what healthcare professionals we're there for, and we are usually okay with taking the blame.
I think one other issue, setting boundaries for folks who aren't used to setting boundaries is, if they're struggling with that, compassion plays a big role in this whole conversation. Encouraging somebody to be compassionate with themselves, to give themselves that boundary that it's okay, that they don't have to do things that they don't want to do, is a real gift, and others will imitate that. They will feel and see that compassion, and it will carry on. So I think that compassionate people, they have very clear boundaries that they insist are respected, and that's a two-way street. It encourages both respect and compassion back. Reframing boundaries is something that could boost compassion towards others, rather than as a selfish act, is definitely a game changer in that conversation. So taking time, space, energy, within those visits and unfamiliar territories to really be safe and take care of yourself and your family.
Yeah, and I also think, and we have this resource listed on the slide now, like recognizing that someone isn't doing well, and being mindful and sort of thoughtful of, like, seeking out help for them, or getting them the assistance they need. We talked initially about how holidays can sometimes be very stressful, and it can actually trigger things potentially, but can make things worse. And so Lisa or Manisha, either of you that wanted to speak to some of the resources for that.
Sure. So it's a great point about not everybody is enjoying the holidays. For some people, it's an incredibly difficult time. It can be a triggering time, especially if they were forced into a situation where there were not appropriate boundaries. Previously they could really be dreading the holidays, and feeling isolated in that. One of the best ways to counter that is connectedness. Another way to counter that is to encourage people. Again, it's okay to reach out for help. That's a sign of strength. To encourage help-seeking behavior, and normalize it. Everybody should have a therapist, is kind of my joke. It's something my college roommate said to me years ago. She said, if everybody had a therapist, the world would be a happier place. I think there's some truth to that. But seriously, considering that it's not all sunshine and flowers for some folks, and that's an okay way to be too, and just accept them in that space without judgment and without criticism, to again be compassionate towards them, and let them know that you are there to help out and be with them, and in whatever it is they need, are some of the really important things.
Those are really good points. Go ahead, Manisha.
I completely agree with what Lisa was saying. I think as far as other resources we have listed here on the slide, but if you or someone you love is feeling down, 988 is a really great resource to access someone to talk to kind of in a professional sense. It doesn't mean someone's going to come and take you life and sirens to an ambulance or anything along those lines, but it is a great place to get some support if needed. I also think that we have to think about what might not take away our support, or it might be something that harms our mental well-being during the holidays. And I think it's important to bring up social media in this context as well. And we have to remember that when people are posting on social media, the people that we know, they're often showing only the best parts of their lives, right? You can have a family that's yelling and screaming, but then they post the one picture where everyone's laughing, smiling that they took specifically for, their holiday card. And remembering that, a lot of what people are posting on social media, again, is just the best parts of their lives, and that the reality might not be all sunshine. And two, to give yourself permission to not engage in social media if that is something that is impacting you. It's okay. Social media can really, I think, negatively impact well-being. On the flip side, it can also be connecting, right? There are some really great people out there who have great resources about how do you set boundaries that do a great job of normalizing, my family, they are not good for me. They do not respect my boundaries. And so I am celebrating my holidays with my chosen family, my friends instead, right? So I think that's just one thing to think about as we're thinking about healthy relationships and loneliness in the context of the holidays, is being mindful about, do you even engage in social media? And if you do, what is it that you are engaging in?
Thanks for that. Yeah, I mean, I agree that, there are times where that connection has been really helpful, especially during the pandemic when we weren't really traveling, right? Still having a way to see others, to see our loved ones. So we're going to move into our last topic, and it's essentially a continuation of what we've just been talking about. But let's say things are not going well at a family gathering or a gathering with friends, and you just don't feel comfortable either going or staying where you are. Are there any strategies to still be able to embrace the holiday period and enjoy your time with your loved ones, but just doing it in an alternate way? Lisa, what are your thoughts for that?
Yeah. So if you're going into a situation where crazy Uncle Mike is gonna push buttons and push boundaries and do things that are offensive, you can have a strategy for how you want to deal with that. Lots of times de-escalation can really work. There are great de-escalation strategies out there. Unfortunately, they're all over social media, Manisha, so I can't give that resource out there, but and it's also okay once you exhaust all of your strategies for dealing with something is going to happen, to leave. To think about, okay, well, maybe it's only a day trip. Maybe we're not going to stay overnight. Maybe I need to go see friends in that city as opposed to stay with family. Maybe I just need to be there for an hour, or maybe I just, if they're being awful, not go at all. There is no reason to subject oneself to a really difficult situation if if you have that option. You know, it's unfortunate, but really we live in a great country that allows us the freedom to move, and we have the freedom to leave, and that's okay. So those are probably where I would start, is kind of strategies to deal with those difficult situations that come up. It's okay to leave. And then if something is truly in compromising your boundaries, your safety, your children, again, help seeking behavior, making a safety plan. Okay, I might not be able to leave, but I might need to retreat to the bedroom that we're staying in. I might need to get in the car and go for a drive. We may need to go for a walk. But again, help seeking behavior of, okay, where can I get to that I do feel safe, that I do feel like my family members are safe, and there is some relief. There's really wonderful resources, even just calling the intimate partner violence hotlines can talk a person through a safety plan. You don't have to go to a shelter. You can actually just talk through a safety plan and have some strategies for how to deal with that particular situation. So many things depend upon lots of variables. And so being able to engage professionals who work in this one-on-one to really talk it through is probably one of the best resources we can encourage the public to think about.
Your thoughts, Manisha?
Yeah, I think having strategies as far as how to handle stressful situations is great. I think having plans about how you're going to leave or exit is also really great. Again, I really love to blame my children, my poor 3 kiddos, right? But I'll say, hey, it's time for my kids to go to sleep. We got to go. That's it. And we plan like, we have to leave here at 8. So we're going to start the exit process at 7:30. So we have enough time. So again, coming up with those excuses ahead of time to extract yourself from tricky situations can be really, really, really helpful. And I think the other thing we have to just put out there is it's okay to not go. It is okay to say, I really want to celebrate this holiday with you, but I can't. And that is a full sentence. You do not have to give them details as to why, but you can give them more details if you choose to. You can think through what those details might be. And you can also come up with creative alternatives for celebrating with loved ones if you don't think that the environment's going to be safe and healthy for you or your immediate family. So, like this picture shows, Zoom has become really popular. There are also similar FaceTime-like apps that people have on phones and on iPads, which is a really great way to still engage with your loved ones without necessarily putting yourself directly in harm's. And, it's really easy if you're on Zoom or you're on your phone, like, oh, the Wi-Fi is getting bad, or I'm losing my connection, and suddenly you've hung up. It is okay. You can do that. You can also have your toddler accidentally hang up on people too. That works as well. And ultimately, we also have to remember family can be defined by blood, but family can also be defined by the people you choose to be in your life. And it's okay to opt to spend the holidays with the family that is not related to you by blood. It's okay to opt to spend the holidays with your family of friends. The previous slide had a picture of what looked like Friendsgiving. And I think that that's such a lovely tradition and a way to support people who might otherwise feel lonely. And it's totally okay to do that if it comes to keeping yourself or your loved ones safe.
Thanks for that. So we are through all of our topics, and we have an opportunity now for question and answer. And we have some questions for our 2 panelists, but would love to get any additional questions from our audience. I'll start with one of the first ones that we had, and we'll see if any others trickle in. This was from one of our guests, Ann Tilly, one of our nurses here in Atlanta. Thank you for your question. So do you have any suggestions about vaping and vaping devices? She's mentioned that she's a nurse in a high school, and if there are like anything that you guys recommend to sort of minimize the risks with vaping or being around those that are vaping, especially as you're visiting.
That's a really, really great question, and has a lot of aspects to kind of talk about. From a bear safety perspective, treating vaping products kind of like medications or edibles and making sure that those products are inaccessible to our youngest family members is really, really, really key. But then there's this added layer of making sure teens don't access these products. We do know that sometimes teens use the opportunity when they're visiting people for the holidays, and not just teens, but even adolescents and older adults, to access not only vaping equipment, but other substances that are not intended for them. So people's medications, for example. And so if that's the case, sometimes you have to think about securing these products safely away from even older people and teens. So you might have to think about, where do you hide them? Can you put them in something that locks with a key that you then hide the key? Something else just to consider. With vaping. And then it also makes me think about cigarette smoke. So that always can be a tough conversation to have with people about safety for others who might have asthma or be prone to inflammation and situations related to that. And that is another conversation altogether, but one that can be important to really have before you go visit someone where you know that vaping and or smoking is something that might be going on in that environment.
Lisa, any thoughts for that?
Just for me personally, vaping and smoking are kind of non-negotiable. I had a family member who was still smoking cigarettes, and I was, like, hey, you're gonna have to do that outside. And even though when she would come inside, she still smelled and reeked of cigarette smoke, and it really became a contentious issue for us. And I finally just had to say, hey, when you quit smoking, we can start visiting in person again. So I think that smoking is really tough because it's legal and people have a right to it. And it is definitely non-negotiable for me personally. The vaping is of particular concern. The littles, nicotine poisoning, the batteries that are used to power them, the sweet flavors, and then of course the adolescents, the preteens, adolescents, and teenagers. They're curious, and they want to try things, and this is just one that we don't know enough about it, especially the vaping. So I think making the points of, we don't know what we don't know about vaping just yet, and the chemicals in it, and anything in there can be too much of anything, and that it can exacerbate problems for folks in the house. Manisha brought up a really great point about sensitive asthmatics. That's really an issue. So that would be those are my thoughts on that.
Yeah, that's really important. My niece and nephew both have severe asthma, and so my sister has had to be really cognizant of where they visit and who they visit. They have a lot of pet allergens too, unfortunately, and so they've often had to like rearrange holiday plans and more often host to have people come to them, and ask that people are wearing like jackets and things that they haven't been potentially smoking in. So we have a couple of other questions that I'll go through them, and Jill, if you can just let me know if there's anything else from the Q&A box. I don't see anything else at the moment, but I'm sure that we'll have more coming. So one of the questions for you, Lisa, are some tactical practices to reduce elderly falls, especially like icy weather, as it's getting colder, both in and outside of the home. Like, what are some of the things that you recommend people prepare for as they're having either elderly individuals visit or as they're getting ready for a visit in their own home?
Thanks. Thank you so much for coming back around to falls and 55 and 65 plus. I think I mentioned at the top of the webinar that falls are a leading cause of death for 65 plus. They lead in trauma data. They lead in TBI. So for our older adults, and we tend to put an age with things, because when you say older adults, everybody says, you know, a 92-year-old says, oh, that's the 96-year-olds, you know. So you really you need to put an age on it. So 65 plus. You know, when we talk about driver safety, we actually talked about 55 plus, because we really want to get the attention of the sandwich generation, who's still got young kids, but may also have older adults that they're helping to care for in their home. And also we want folks to plan for driving. But in terms of fall prevention, again, a scan of the environment, a conversation with the adult about, are you comfortable here? Are you able to move easily here? You know, we recently had my 94-year-old mother at the house, and she said, you know, I need a place to hang on to. And so we talked about keeping certain paths very clear, so that she could both walk without any kind of rug or door jam or you know, trash can or anything like that. But that she also was plotting out the places that she was gonna reach out to in case she did lose her balance. And was super proud of my mom for just thinking through that and being like, okay, I need to come this way if I'm going to come into the dining room. The second thing is all the risk and protective factors for falls in our 65 plus population also apply to driving. So that would be one other issue to potentially, if there's room to engage around that. So important to be thinking about a plan for how one is going to get to doctor's appointments in the store and the hair shop and all of those things for 65 and up, or when they no longer feel confident to drive. There's a lot of really great self modifying behavior that goes on. I know with my own mom, she got to a point where she did not want to transport her grandchildren anymore. She did not feel like that was a responsibility she wanted. And I really appreciated her articulating that. And we really honored that. She felt confident to go to the store and go to church, and that was fine. But she did not, you know, picking up from school, even though it was around the block, was just not on the agenda anymore. And that's okay too. In terms of other fall prevention measures, one of the greatest things, if to empower folks who are concerned about a fall, is to encourage them to get active. Building core strength really helps in so many disease processes. And getting medications checked, seeing if there's any bad potential interactions with medications, present company not included. Some specialist doctors don't always consider what other specialist doctors might be prescribing. And so having a conversation with a pharmacist or a double check about all the different medications is really a great idea, or checking in with one doctor about all the medications, because that is absolutely a fall hazard. And then Manisha brought it up early in the webinar about pets. May have to have separate areas for pets. May have to actually, they hang out in the basement for, you know, all but a very brief supervised period, or they may need to be outside if that's a possibility, as opposed to in the house like they usually are. So a couple of things for consideration. But those are some of the main fall risks and protective factors to think about. Physical health, core strength, medication interactions, unintended ones, the small things, clearing the path, any trip hazards, also having those places to grab onto. Grab bars are great. That takes some remodeling. Not everybody's able to do that in all the places. So, but thinking about, the countertop that they want to grab or lean on, those kinds of things. And then the pets, the small items with legs. We definitely want to consider that as well. So
Those are all really good tips and points. And I would say, I think either you or Manisha had mentioned earlier too, getting your family involved, getting your kids involved in helping, right? So like for us, all my kids love to dump their train sets and their blocks, and they put them everywhere. And so now when my parents visit, we have a strategy with them that they can do them in this side of the room. And I tell things to my 5-year-old, like, well, you can't go across this line because that's lava, and so that's something that they get into. And then I have noticed that they themselves are like rapidly picking up things to get out of their way as my parents are walking around. So that's always fun, to involve them in that and to have them understand, like, why it's needed. Some of the other questions that we have here are, what are some signs that children and adults may have gotten into someone's medications? What do you do in case you suspect an overdose, especially from opioids? And I know that we have a lot of school attendees online to school nurses and individuals that may be working in the school system.
That's such a great question. So, sometimes you don't know if a child or an adult has gotten into something they shouldn't have from a medication perspective. But signs that would make me worried about it as a ER physician include, a child or someone suddenly having difficulty walking, having changes in their mental status, how they're interacting with the world, a child who might have color changes to their skin, looking pale or blue, or even really red and flushed without a good explanation. Children who might be having some difficulty breathing as well. Those are all things that would make me worried that this child or adult get into something. And in that instance, if you're worried about it, the first thing you do is you look at this person. If they are, really seem like they are having severe trouble breathing, their color really, really, really looks off, you really think that their life is in danger in that very moment, call 911. Do not delay. But if that's not what you're seeing, or you saw your child, eat somebody's medication or, get into something they shouldn't have, the folks at the Poison Control Center are so incredible. Their number nationally is 1-800-222-1222. And I think it's on a previous slide. This center number is manned by people 24/7, 365. So you can call on Christmas Eve, you can call on Thanksgiving, you can call anytime. You will get an amazing human being who is trained to help people with these situations. And they do a really great job of helping you figure out if you need to go to the emergency room or not. There are sometimes that they get a call and they can actually tell the family member, that's not actually a toxic dose or exposure. You can watch your kid at home. And there are other times that they can say, no, you absolutely need to go into the hospital. And they can actually call ahead and give the hospital a heads up that, hey, this person is coming in. I think the other thing when it comes to poisonings, just to also be mindful that it's not just medications, cleaning products or something else we need to think about. And then also certain plants like poinsettias plants can be dangerous as well in terms of exposures. You did bring up opioids as well, which is definitely something we have to think about with young kids unintentionally accessing them, but also, adolescents who are intentionally trying to look for these medications for experimentation. And that's where I think a lot of the new laws regarding great access to Narcan is so important. So if you have someone in your home who's been on an opioid, you should make sure that you have Narcan available in your home. If not, in a lot of different states, you can actually go to the pharmacy and ask for it. There are people who have Narcan just because they're trying to be a responsible citizen in case they ever come across someone who might have had an opioid exposure. So that's also something you can consider doing. Lisa, I'm not sure if you have more on that topic specifically as well.
Just want to reiterate the plug for the Poison Center, not only for potential overdose, but personal care products, deodorant, the fruity smelling sprays that my teenager loves. All of those things can be ingested unintentionally by smaller kids. They can be mistaken sometimes. There are lots of lookalikes. The other thing to call the Poison Center for, and not a lot of people know this, is for animal bites, stings, anything where you're like, I need somebody right now who knows how to walk me through something. That's if the panic sets in, that can be a great first call. However, as Manisha said, if it is physically a really difficult situation, 911 always.
Really critical and really important. So we are at the end of our session, and going to wrap up as we're close to the 11:30 timeframe. So here are some of the resources that we have put together in terms of ones that are some of our favorites for families, friends, and our health department staff. We're going to include all of this in the follow-up email. These are all active links that you can click on, and so we will send them to you all. We recently came out with our Georgia AAP Play It Safe Toolkit. That's the top one. And Be Smart Secure Gun Storage and our Strong for Life CHOA safety resources are all ones that have really great pediatric information. With my PEDSAT, of course, I'm going to go there first and recommend those. But any of these are good resources. And we'll also list the suicide crisis line and the Poison Center number in our email so that that's easy to share. We would like to thank all of you for joining us today. And if you would like to connect with any of us, you can either email me or our presenters. We are happy to answer additional questions after the session's over by email. And you can scan the QR code on the screen below our names. We hope that all of you have a safe holiday season, and we are excited to connect with many of you in the future. And for any of you that are going to be online tomorrow, excited to see you guys join our chat from 1 to 2 p.m. For the National Injury Prevention Day and using the hashtag #BeInjuryFree. Thank you.